Hey everybody. So I'm just going to jump into it. So two key characteristics of the organizational culture for my field placement. So for context, I'm doing my field placement in an inpatient psychiatric unit that serves the senior citizen demographic, um, primarily people 55 and up. Every now and then we'll get somebody that's a little bit less or something, but generally speaking, 55 and up. A lot of dementia and Alzheimer's along with that. So two cultural things. Okay. So the first thing that stands out to me in the culture at this unit is there's sort of an us versus them divide between the social services and the nursing side. So when I say social services, I mean social workers, discharge coordinating, things like that. In a way, the psychologists too. But there's a pretty big divide between the two where it sort of looks like the stage three, I'm great, everyone else isn't type thing, where the nurses all feel like the psychosocial assessments and all that aren't quite as important as med management, and then sometimes you see the social work side of things. Sorry, cat. You see the social work side of things trying to um, take some leadership in the treatment planning, and they're just kind of a headbutting going on there. Um, but at the same time, there's also this weird sense of unity where we all recognize that we're here for the patients and we're not here for fun or something like that. It's not like we wake up and say, today I'm going to go try and make the nurses happy. I mean, that's a part of it, is to keep our colleagues happy, but that's not the primary goal. It's the patients, and the medical side of things seems to get that just as well as the social work side of things. Um, Another one is, and I think somebody mentioned this in one of their threads, an organized chaos, where when it comes time for admissions and discharges, everybody is kind of scrambling to do their part of it. The nurses do their assessments, the social workers do theirs, the doctor does theirs, um, and so there's this sort of chaotic culture going on. But at the same time, we're all on the same page, and we all recognize that each person has to get theirs done. So we're pretty cooperative um, in that way. Um, I think that this is sort of a stage three, and I mentioned that a minute ago. And the reason I think that it's a stage three culture or a tribal thing is that each person seems to think that their work that they do is the most important. The doctors can come and pull a patient out of a psychosocial assessment anytime because they have to do their thing. Um, you know, we can pull patients out of a group to do theirs. We can do, and by we I mean the collective unit. But everybody seems to have this belief that theirs is more important, and I'm not sure where that comes from. It could be that um, everybody wants to get all their stuff done, and so we kind of put ourselves first rather than trying to put the team together. Um, so that's kind of where I'm at on all this. So I hope you all have a great night, and good luck with the rest of the course.